So tonight we're going to be talking about several things. The first of which is we're going to talk about the state of older adults' mental health, and specifically talk a little bit about depression. We're also going to talk some about anxiety later on. And then how can we actually look after our mental well-being? What can we do to keep ourselves mentally healthy? And then very important in this time we've been through for the last 9 months is how to build mental resilience during the pandemic. And I know some of you are thinking, well, why should we know this now? We're almost through it, we're getting vaccines, but the truth is we're gonna have to deal with a lot of those same issues of isolation for at least 6 to 9 months, if not longer from now. So what is mental health? Well, a really simple way of explaining it is it's how we think and feel. It's our outlook on life. It's how we're able to cope with life's ups and downs. And it is a very essential part of our overall health. So when we look at older adults, it's important to know that 1 in 4 of adults who are 65 years and over can experience some type of mental health concern. The most common of these are depression, anxiety, and cognitive impairment. We aren't going to be speaking specifically about cognitive impairment tonight, but we will talk about some things that may help prevent the development of cognitive impairment. But if you look at the little word diagram here, these are all the sorts of things that people can experience with their mental health or lack of mental health. So let's talk about depression. As we get older, obviously we get a lot of other illnesses, and with that, our rate of depression also increases. And somewhere between 11.5 and 13.5% of older adults have depression, and that's double what the rest of the adult population suffers. Almost 5% of seniors have experienced a major depressive disorder in the last year, so it is very common. So who actually is the person who struggles with depression? It can be anybody, and if you look at these statistics, as you can see, the chance of being depressed does get higher as we lose more and more of our independence. So 1 to 5% of elderly people who live independently in the community have depression. 11.5% of those who are hospitalized. If people need health assistance at home, it can be about 14% of those people who have depression. If you need to live in an actual nursing home, then 29 to 52% of the population there can develop depression. And people who are seriously physically ill can have 39 to 47% incidence of depression. So what does getting depressed do to us besides obviously making us feel terrible? Well, as we age, depression is really a problem in terms of complicating the treatment of other chronic diseases we might have. And older adults who have depression often need to visit the doctor and emergency room more often. They use more medications. They often have higher outpatient charges in terms of having to visit the doctor in the ER. And if they're in the hospital, they often stay longer if they have depression as a secondary problem. Suicide is a really big deal as we age, and especially in men. This is a list of suicide rates per 100,000, and it's from 2016, so it's not necessarily the most up-to-date data, but this is what the CDC had available. Men 65 plus have a 32.3 suicide rate, 32.3 people per 100,000, whereas women over 65 are only at 5.2%. So women seem to peak with their suicidality in more middle age of 45 to 54, whereas men, it goes up and up and up as they age. So Even though older adults only comprise about 12% of the US population, they account for almost 18% of all suicides. And people who are 85 and older have the highest suicide rate of any age group. There's a statistic that white men who are 85 years and over take their lives at 6 times the rate of the general population. So it is not a small problem. So what about depression itself? I mean, obviously the worst thing that can happen with depression is suicide, but there are other levels of it too. So, what's going to make you more likely to develop depression? Well, women actually do develop more depression over age 65 than men, even though the suicide rate in men is so much higher. Certainly, if you're on certain medications that can change your mood, that may make it easier for you to develop depression. Chronic illnesses and chronic pain are certainly one of the things that can lead to depression. Being disabled clearly also can contribute. If you don't have family support and you're spending a lot of time alone and you don't have a good social network, those are things that can cause you to be more likely to become depressed. Not sleeping well is another trigger for depression. Clearly, if one abuses alcohol or other drugs, that increases the likelihood of depression. And even just going through any kind of stressful life event, which unfortunately we all know there's a lot more of those as we age. We lose friends, we lose family members, and those certainly can increase our risk of depression. So one of the problems, especially in older people, is we sometimes miss the signs of depression. And with older citizens, a lot of the times people think, well, is it just me feeling tired? Is it just because I hurt all the time? And less than 30% of older adults actually end up getting proper treatment for their depression. And again, as I was mentioning, it can be confused with a lot of different types of illnesses. Seniors do tend to ignore their symptoms, thinking it's just normal to feel this way as you age. And those, in turn, are some of the stereotypes about aging. And the other thing is sometimes family members may think, oh, it's just because your social support system's changed and you have to now live in assisted living, and it's not depression, it's just because you're unhappy that you have to go to assisted living. So these are things we really need to be careful to watch for in older people. Some of the warning signs of depression in the elderly are feeling really empty. Sometimes anxiety can be a sign of depression. When people start feeling guilty or worthless or helpless, they stop having interest in hobbies that they used to love, really just feeling pessimistic, feeling fatigued, feeling just like everything's slowing down. And then it's important to know that sometimes having difficulty concentrating or remembering or making decisions is not necessarily a sign of cognitive decline, but can be a sign of depression as well. So it's very important if somebody's having memory problems to really tease out how much of it is true cognitive decline and how much of it could be depression. Obviously, if people are thinking about death and suicide, that is a warning sign of depression. Sometimes people just stop eating, or their appetite really changes where they suddenly start eating a lot and gaining weight. And there's also many physical manifestations of depression, especially in the elderly, where you can have different aches and pains or problems with your digestive system that may not really have a very clear physical cause, and they don't really get better with the usual things that people try to treat those things with. So how do we treat depression in the elderly? Well, there's many different things to do, and often we do a combination of these treatments because every person is different and every person responds differently to different things. So clearly, medications are definitely there for depression, and that could include seeing a psychiatrist, although, often your primary care physician is quite good at handling depression. Getting psychotherapy is a very important part of this. It doesn't always have to be, going to a psychotherapist's office. They now, especially for the elderly, have opportunities to have in-home psychotherapy. And clearly now, there's online things for having therapy, including group therapy and peer support groups that can be individual or group. Some elderly folks do need case management, and that's somebody who helps to try to navigate all these different ways of treating the depression, to try to help them with the social issues that are going on, to help them really, connect properly with their doctors and therapists. And then, of course, if depression is caused by grief that is not getting resolved, because it's okay, we understand we're going to be sad when we have grief, but when it's continuing and doesn't go away, that can be depression caused by grief. So, getting counseling and support around grief early can also help prevent and treat depression. Just being around people and having more activities can help with depression. And so, we are recommending, and you'll hear a lot about this later in the talk, about just having activities and socializing. So at BCH, the primary care practices do a lot to try to recognize depression in the elderly and to have ways to get them help. So we have a thing called the Patient Health Questionnaire, and some of you may have taken it. It's called the PHQ-9, that is used as a screen on every one of the Medicare wellness visits, and we can often pick up depression on those. Certainly, we don't only do the screening with the Medicare wellness visit. If someone comes in and we're suspicious they may be depressed, or we see some of those things that I talked about that can kind of mask depression in the elderly, we'll often do one of these then as well. So then what do you do? What do you do about depression, especially in the primary care clinic? And who decides what to do? Well, every provider is different and every patient is different, and it has to do very much with the relationship between that provider, their patient, and how comfortable the provider is helping to treat depression. So some of the things that the provider can do is, if they're comfortable with it, start medications, or maybe somebody's seeming a bit depressed but isn't at that point where we think it has to be treated, and we can kind of just watch and check in and make sure everything is staying pretty stable. The wonderful thing that we have available to us at BCH is our integrated behavioral health team. And we can, and I'll talk about that more on the next slide, but we can have one of our behavioral integrated health people help us with the patients with depression. So every primary care clinic at BCH does have some level of integrated behavioral health. It's been a little harder during the pandemic because we used to always have someone who at least part of the time was physically at the office. And so that made it so if we had somebody who was in distress, we could often have the behavioral health specialist meet with them right then and there and get started on things. That's been harder now with the pandemic because the behavioral health specialists have to be off-site. But we can call them immediately if we need them for more crisis situations or for something that doesn't need immediate attention. We send an email or a note and have them contact the patient. So being able to have somebody come in and help with this without trying to go, oh, well, we need to find you a therapist out in the community or a psychiatrist out in the community. I think all of you realize that can be very difficult, and especially if the issue is insurance and someone doesn't take it and you can't afford to pay out of pocket. This is something that we have as not only a stopgap measure, but also to help find the proper resources down the line. Well, now, how do we look after our mental well-being? there's a lot of stuff that we can do. First of all, it's really important that if we have problems and concerns, we learn to talk about them and not just keep them inside. So who can you talk to? Well, you can talk to a counselor or a therapist or a religious figure that you trust. You can talk to friends and family, somebody with specialist knowledge, your doctor, a therapist, someone like that. And then also a lot of people reach out to support groups, especially during times of change. So for instance, if you're suddenly going to now move into a senior living situation instead of being at home, there often are support groups at those facilities for people who are adjusting to this change in their life. And it's really important to say what you feel and not say what people think, what you think people want to hear. I mean, I can't tell you how many times I've been talking to someone who I suspected might have depression, and it's, oh, I'm fine, I don't want to bother you. Really, please tell us if you're not feeling right. And listen to other people. And if you hear things from someone else saying, oh, this is what depression is like, and you go, oh, wait a minute, I'm having some of that. Please learn from that and know that there's help for you. One of the hardest things with aging is coping with change, and we do need to learn how to do that. So there's some really simple things, and I don't mean to make these sound trite, but it's important to really focus on the things you're grateful for. And then also, if you're having negative feelings, to acknowledge those and process them and say, okay, I understand why I feel like this, but I don't have to feel like this. And not to sound like AA, but then accepting the things you can't change. It works for everybody. If there's a silver lining in something, look for it. So, a lot of people who've been stuck home with the pandemic, for instance, say, I really hate not being able to be out, but man, I've read some good books and I finally, learned how to knit or things like that. So even in bad times, there are often these silver linings. The other thing that's important is we need to take daily action to deal with our life's challenges. We can't just kind of go, okay, I'm just going to let it go by. I mean, it's going to take an active thinking about things, changing things you can change, not over worrying on things you can't change. Staying physically active has been shown to be an amazing way to help prevent depression. Regular physical activity and exercise raises your self-worth and boosts your self-esteem. It makes you feel more confident about yourself. It gives you something to do. I mean, a meaningful activity is important. Sleep does get better if you exercise regularly. Certainly, we don't want you to exercise right before bed, but sleep does improve your mental health, your mental well-being, and avoiding depression. And the exercise helps you sleep better. There have been studies that have shown that staying physically active really does help your brain. It helps prevent memory loss and cognitive decline, and it may help prevent or at least slow dementia. There's some dementias, I said I wasn't going to talk about that much, that are genetic, and keeping your brain active certainly can help, but it's not the be-all, end-all. It's not like if we all stay active mentally, we're never going to get dementia. So exercising, a lot of people go, well, I haven't been exercising and I'm older, and is it safe for me to do that? So the first thing is to check with your doctor first and make sure there's no reason you shouldn't be exercising, and also to kind of help figure out what kind of exercise makes sense for you. For almost everybody, unless they're having a lot of really bad orthopedic or balance problems, walking is a fabulous type of exercise, and it's pretty safe, and it usually doesn't hurt your joints. But it is important to find an activity that actually motivates you. So if walking is something that you just go, bleh, but riding an exercise bike while you're, reading a novel sounds good, then that's what you should do. It's very important that you just don't go, okay, I'm gonna start walking and tomorrow I'm gonna go walk 4 miles. You have to start slowly and build your strength up. And as I said about walking, exercise doesn't mean it has to be strenuous. And it's a way that you can have some social connection if you exercise at a distance with a friend, or it can be closer if it's a family member and you've been quarantining together. But it definitely is nice to take a walk with your masks on, with a friend outside. I do that when I can. Another thing that's very important to help us stay mentally healthy is to keep our minds active as we age. Certainly, reading can do that. People like to play games, Sudoku, things like that, tackling puzzles. Those all are things that help the brain stay healthy. If you're not into those things, even just trying new recipes out when you're cooking, or if you like to do crosswords, trying one that's a little more challenging than you normally do. Trying new things is very helpful, including maybe trying to learn a foreign language or an instrument you always wanted to play in your youth. And then some people, especially during the pandemic, have taken hold of this by writing their memoirs or other writing endeavors, which is great. And they say that it's important to try a little something new every day. I mean, I don't know that we can really do that every single day, but with that in mind, we do things, we'll be able to do new things at least at some pace. And here, this is my hero, get plenty of sleep. Sleep is like my superpower. It really is an amazing thing for restoring your body and your mind. It's been shown that if we are getting good and adequate sleep, we'll have better mood, we concentrate better, our immune system is better, which is especially important in these times. So sleep patterns definitely can change with age, but there's also a lot of things that we do to ourselves that mess up our sleep. Pain, of course, can mess up your sleep. Certain medications can make it more difficult to sleep. Caffeine and alcohol clearly decrease sleep if used either in excess or at the wrong time. And unfortunately, a lot of us as we age do have to get up to go to the bathroom a lot at night. And if it's many, many times, that certainly can disrupt sleep. But if you're one of those people who has to get up once or twice a night to go to the bathroom, and you get back into bed and you fall right back asleep, you're okay. And different people do need different amounts of sleep. And the way you can tell whether you're getting enough sleep is you should wake up in the morning and feel good and feel like you can get through your day without having to nap. So some of the things that you can do to help have healthy sleep habits are really simple, like making sure that your bedroom's quiet, making sure it's dark. So, if the moon's shining in constantly and it's time to get some curtains that block it a little more. And having a cool bedroom is helpful. I think they say that, keeping your bedroom at about 60 degrees is like optimal. One thing that I think all of us struggle with is there's people who have the TV in their bedroom, or we're looking at our iPad or our computer, and it's really important to try to avoid that type of artificial light from screens for at least an hour before you go to bed. It's also important for a lot of people to really try to maintain a regular schedule where you don't sometimes go to bed late and then get up late, and other times go to bed early and get up early, just to try to keep your schedule of sleep at about the same time every day. Eating and drinking sensibly obviously is important for our health, and it's important for our mental health as well. The AARP did a survey with men and women over 50, and they actually found out that people who reported eating more nutritious and well-balanced meals also had a higher score on mental well-being test that they did than the people who said they rarely ate nutritious meals. So to do that, you want to really load up on high-fiber fruits and vegetables and whole grains, and eat at least 5 portions of fruit and vegetables a day. Sometimes when I say that 5 portions, people are like, oh, that's a lot, but it's not when you think a portion may be just like a cup of the vegetable. So, and really try to avoid a lot of sugary foods and refined carbohydrates. The Mediterranean diet is a really good diet to follow because it follows these ideas. And I do have to remind people that alcohol counts as a sugary food and often counts as a carbohydrate. One of the things that I think many older people struggle with is staying hydrated. And part of that is because we actually lose some of our thirst response as we age. So, you know, why drink a glass of water if you're not thirsty? But it is really important for keeping the brain functioning properly and our joints and everything to stay adequately hydrated. So sometimes you need to tell yourself, oh, I better have a drink of water even though I'm not thirsty. So that's something to really consider. People sometimes ask, well, what's the proper number of glasses a day to have? Well, there's no really great data about that. You know, people always had that drink 8 glasses of water a day. But probably 6 is also reasonable, and it doesn't always have to be water. Other fluids count. So just, this is kind of embarrassing, but one of the ways that you can tell you're getting enough fluids is your urine should be fairly light in color. If you're taking certain vitamins, it can make your urine pretty yellow, but as the day goes on, you know, if you take your vitamin in the morning, it's not going to be interfering with your ability to tell what your urine looks like later in the day. The other thing that's an issue and has really become a big issue for people during the pandemic is trying to not drink excessive amounts of alcohol. The slide says, you know, for women, we don't want you to have more than 1 alcoholic drink per day, and that's true. For men, not more than 2 alcoholic drinks per day. But now there's new data for men over 65 that probably they should have the same amount as women. In other words, no more than 7 drinks a week, and preferably no more than 1 drink at a time. You know, obviously you can sometimes have 2 drinks, but that's the ballpark you're looking for. And then there is definitely a link between mental well-being and dementia. So having a purpose can reduce your risk of dementia, and the more active and the more you use and sharpen your brain, the more benefits you're going to get. And again, that I really want everybody to understand that does not mean you won't get dementia. You certainly still could, but perhaps it'll come at a later time in life than it would if you weren't doing these things.